Welcome to our channel, where we explore important health topics to help you stay informed and take charge of your well-being. Today, we're diving into the realm of heart health and discussing the signs and tests used for diagnosing heart disease. Heart disease is a serious condition that affects millions worldwide, and early detection is crucial for effective management and treatment. So, let's equip ourselves with knowledge and learn about the various signs and tests that play a vital role in diagnosing heart disease. Understanding heart disease. Before we delve into the signs and tests, let's briefly understand what heart disease is. Heart disease, also known as cardiovascular disease, refers to a group of conditions that affect the heart and blood vessels. It includes coronary artery disease, heart failure, arrhythmias, and more. These conditions can lead to various complications, including heart attacks and strokes. Risk factors for heart disease. Knowing the risk factors for heart disease is essential for prevention and early detection. Some common risk factors include smoking, high blood pressure, high cholesterol, diabetes, obesity, a sedentary lifestyle, and a family history of heart disease. By recognizing these risk factors, we can take proactive steps to lower our chances of developing heart disease. Signs and symptoms of heart disease. Heart disease can present with various signs and symptoms, some of which may be subtle or easily overlooked. Let's explore these warning signs that indicate the need for further evaluation. Sign 1. Chest discomfort. One of the most common signs of heart disease is chest discomfort or chest pain, often referred to as angina. This discomfort may feel like pressure, squeezing, fullness, or pain in the chest area. It may also extend to the arms, shoulders, neck, back, or jaw. Sign 2. Shortness of breath. Another important sign to watch out for is shortness of breath, especially during physical activity or at rest. If you find yourself becoming easily winded, it could be a signal of underlying heart problems. Sign 3. Fatigue. Feeling excessively tired or fatigued, even with minimal physical exertion, can be an indication of heart disease. If you notice persistent and unexplained fatigue, it's essential to seek medical advice. Sign 4. Dizziness and fainting. Heart disease may lead to episodes of dizziness or fainting, which occur due to insufficient blood flow to the brain. If you experience these symptoms, it's crucial to get evaluated by a healthcare professional. Sign 5. Swelling. Fluid retention and swelling in the legs, ankles, and feet may also be signs of heart disease. The heart's inability to pump blood effectively can lead to fluid buildup in the body's lower extremities. Part 4. Diagnostic tests for heart disease. Now that we've explored the signs of heart disease, let's move on to the diagnostic tests used to assess heart health and detect any underlying issues. Test 1. Electrocardiogram, ECG or EKG. An electrocardiogram, commonly known as an ECG or EKG, records the heart's electrical activity. It helps identify irregular heart rhythms, signs of previous heart attacks, and other abnormalities. Test 2. Echocardiogram. An echocardiogram uses ultrasound technology to create images of the heart structures and assess its pumping function. This non-invasive test provides valuable information about the heart's health. Test 3. Stress test. A stress test, also known as an exercise treadmill test, measures the heart's performance during physical activity. It helps identify any abnormalities that may not be apparent at rest. Test 4. Cardiac CT scan. A cardiac CT scan uses specialized X-ray technology to create detailed images of the heart and blood vessels. It can detect issues like calcium buildup in the arteries and assess coronary artery disease risk. Test 5. Cardiac MRI. A cardiac MRI provides detailed images of the heart structures and can reveal problems such as heart muscle damage, valve disorders, and congenital heart defects. Test 6. Coronary angiography. Coronary angiography involves injecting a contrast dye into the arteries to visualize blockages and narrowings that may be causing reduced blood flow to the heart. Part 5. The importance of early detection. Early detection of heart disease is critical for preventing complications and providing timely treatment. If you experience any of the signs we discussed or have risk factors for heart disease, don't hesitate to reach out to a healthcare professional for a comprehensive evaluation. Part 6. Prevention and lifestyle changes. While diagnostic tests are essential for identifying heart disease, prevention is always better than cure. Adopting a heart-healthy lifestyle, including regular exercise, a balanced diet, managing stress, quitting smoking, and controlling other risk factors, can significantly reduce the likelihood of heart disease. Thank you for joining us in this informative discussion on the signs and tests used for diagnosing heart disease. By understanding the warning signs and seeking early diagnosis, we can work towards preserving our heart health and enjoying a fulfilling life. If you found this video helpful, don't forget to give it a thumbs up. Subscribe to our channel, and hit the notification bell to stay updated on future health-related content. Remember, your heart is a precious organ that deserves the best care. Until next time, take care and prioritize your heart health.